Hello, Dr. Anselmi in class. My name is Tasha, and in week two's discussion, we were asked to discuss how Florence Nightingale has influenced nursing over time and how the changes she's made through her research and studies influence the 21st century nursing practice, creating an environment for evidence-based practice within the community setting. According to Smith 2025, Florence Nightingale was born in 1820 in Florence, Italy. At the age of 17, she believed she had a calling from God to service humankind. Over the next 16 years, she began to develop herself through her work and practice during the Crimean War, practicing on wounded soldiers. She made a name for herself and is known as the founder of nursing, paving the way for future nurses. Smith 2025. As she cared for the ill and wounded, she paid attention to details that mattered, including highly unsanitary environments that ultimately contributed to their further deteriorating health statuses. Recognizing the need for change, she made drastic alterations that improve health outcomes, such as providing clean air, water, proper nutrition, hygiene, clean bedding and linen, proper lighting, warmth, quietness, and efficient drainage and sanitation. These changes led to the development of her environmental theory, which is commonly used in today's nursing evidence-based practice, Smith 2025. With these changes, she saw improvements in health outcomes of the ill, decreasing death rates, improving overall wellness. She was one to describe what nursing is and what it is not. Compiled by her daily notes, her practice, developing an early systematic perspective of defining nursing. As Nightingale identified the laws of nursing, it was understood that nursing would be classified as a science, stating that all nurses must be trained to their positions. Nurses should be separate from medicine. Environmental factors greatly impacted patients' health. The disease process is not important to nursing. Nursing should support the environment to assist in patient healing. Research should be observational as well as evidence-based. Nursing would become empirical and an art. Nurses should be prioritized by the person and the environment. The person is influenced by the environment. Sickness and wellness are governed by laws and health. And lastly, nurses should be observant and confident. Smith 2025. Nightingale's work ultimately led to public health reforms, infection control practices, and influenced public health decision-making today. Florence Nightingale's legacy still impacts nursing care and practices today through ongoing nursing education foundations, rules and regulations within hospital settings, clinical and community settings, continuing to be an example and guide for all healthcare professionals around the world. Nursing situations that validate my thoughts and support Nightingale's vision and theory include hospital-acquired infections. Patients are often bedbound, limiting their ability to get up and move around on their own. This directly impacts their circulation, lung ventilation, hygiene, and clean air. Patients needing catheters are at the mercy of nurses taking priority to utilizing effective hand washing hygiene, which can ultimately lead to UTIs, and in the chronically ill and elderly patients lead to sepsis. Patients having recent surgery and bedbound are at increased risk for pneumonia due to their lungs not working at full capacity and potential germs spreaded by nurses and other medical professionals entering and exiting their rooms with improper hand washing. Airborne transmissions occur through lack of proper PPE utilized by healthcare professionals, especially those that are at increased risk and with immune weakened systems. As a professional nurse, we must recognize the importance of effective leadership that promotes safety, health, and wellness for all patients, which was greatly influenced by Florence Nightingale's environmental theory.